Welcome to another edition of Inside Washington Hospital. I'm your host, John Thomas Mehigan. Quality care and the patient-first ethic are the principles that guide everyone at Washington Hospital every single day.
Hello, welcome to Washington Hospital. How can I help you?
He has an appointment for his pacemaker.
Okay, let's see. Oh, he's on the schedule. Go ahead and take a seat and we'll be with you momentarily, okay?
Thank you.
Thank you.
It's with those principles in mind that the doctors, nurses, administrators, and staff of all divisions at Washington Hospital work together to build and sustain a culture of safety and shared accountability, and to continuously improve outcomes for patients from the moment they arrive at the hospital. One example of this commitment to patient safety can be seen right here in the emergency department, where the staff now includes a clinical pharmacist. The pharmacist works closely with the emergency department physicians and patients to ensure that appropriate medications and doses are prescribed. With me is Dr. David Orenberg, the medical director of the emergency department at Washington Hospital.
We have a new information system in the emergency department which will identify any kind of mismatch between the medications the patients are taking versus the medication that we may want to put the patient on. If we don't happen to have a pharmacist in the department, we can also call. So that's been very helpful as well.
Well, by nature, emergency department is a high-risk environment because of the high turnaround rate of the patient, the severity of illness that the patient comes to the hospital, and also the urgency of delivery of this care to the patient.
We're trying to participate actively in different facets of medication process, that including the prescribing, the distribution, the administration, as well as monitoring. So we assist the physicians in choosing the optimal therapy using evidence-based medicine. We facilitate or expedite the delivery of medication from the pharmacy to the emergency room. We also help the nurses to double-check, or some cases triple-check, pediatric doses or high-risk medication dosage.
We also expedite the drug delivery, especially in the emergency cases. And like you said, in the drug information type of question, by us being there, it's very accessible for them to ask us any question.
Do you have any allergies to medications, Mrs. Smith? Our main purpose here is to improve patient outcomes and to reduce medication errors. And we try to do so by incorporating ourselves into different facets of daily emergency room practice. Okay, thank you for the information, okay? I'll be back to see you again. Okay, thanks. I think just the fact that having a pharmacist in the emergency room that the physicians and nurses know and trust means that they are more likely to ask you questions. And so that kind of, in a sense, remove a barrier of communication.
As far as healthcare is concerned, medication safety has been one of the top priorities in this country. The bottom line is that putting these kinds of safety measures in place help us make sure that the medications that we do give patients are safe.
As the patient moves from the emergency department to the intensive care critical care unit, we can see Washington Hospital's coordinated team approach at work. Another of the ways the unique challenges of assuring patient safety are met here at Washington Hospital is through the practice of multidisciplinary rounds, a process where a variety of staff and specialists work together to determine the best and safest treatment of the patient.
What's the goal for the day?
This is a patient of Dr. Mehigan. Ronnie.
By combining the perspectives and insights of multiple disciplines through this coordinated team approach, the safety and continuity of care are greatly improved for every patient. Dr. Carmen Akawili is the Medical Director of Intensive Care Services and heads this interdisciplinary team.
Hi, how are you doing today? Not better. Not better? The ICU is a very, very high risk kind of an area. So you really need to make sure that your goals are clear. So to improve patient safety and quality, we have formed a team. So the reason for ICU?
Because he was bleeding and his blood pressure was...
So post-operative care, bleeding, and blood pressure control. Okay, so the goal for today is follow up the chest pain, the blood sugar, OTPT, right? And then any family issues. Okay, let's go see the patient. We go and see the patient and improve communication. We have a sheet of paper where we write down there what's going on with the patient. We prioritize our goals. What's the big picture? Anything happened within 24 hours? Why is the patient still in ICU? What can we do to get that patient out of the ICU? I think the patients are safer because the team and the rounding can prioritize things, identify the patient, what happened in the last 24 hours, what can be done now, what can be planned ahead, and there's communication among everybody. So overall, you are doing what is right for the patient, and in the end, you are saving the life of the patient and improving patient safety.
When we come back, patient safety involving the patient and family, and a program we call Please Ask.
You were not created in 2 dimensions. You are a complex construction of muscle and bone, blood vessels and synapses. Seeing your inner workings takes some equally sophisticated technology. That's why at Washington Hospital Outpatient Imaging Center, we've invested in the most advanced digital imaging equipment so we can diagnose you quickly and accurately. We see the whole you to treat the whole you. Go to WHHS.com to learn more.
Washington on Wheels brings health services to people in the community who otherwise wouldn't have access to quality health care. And take it from us, there's nothing more frustrating than being denied access. To find out when Washington on Wheels is pulling into your community, go to our website.
Flannel pajamas get rid of a cold 20% faster. You can clear up pink eye by watching black and white movies. I put garlic around the kids' necks. They stunk, but they were healthy. I raised 3 kids. I think I know a thing or two about doctoring.
Presenting the InHealth channel, a much better source of information on issues affecting your health and safety. Brought to you by Washington Hospital.
You're not even listening to me.
Preventing the spread of infections in hospitals is a serious and systematic procedure here at Washington Hospital because we understand the critical importance of providing a clean, safe environment for every patient. Mary Bowron is the Infection Control Program Coordinator at Washington Hospital.
The first thing that we really try to do here is create a culture that is stating that everybody who's in the hospital, whether or not you take care of patients directly or you don't, that you're all responsible for infection control prevention. We do surveillance of particular surgical procedures. We watch high-risk populations for infections. We do MRSA screening here on certain populations of patients.
Now what about hand washing? We're often with isolation, antibiotics, and masks and so forth, and gloves. But hand washing?
Yeah, it's interesting because it is the least expensive form of infection prevention and probably the easiest to do and the quickest. And luckily for us, it's the best way to prevent the spread of infection. So
the best way?
It is. That
really?
is the single most effective way you can stop the spread of infection.
Before a patient is brought to a room on the hospital floor, a great deal of work is being done to prepare the room for his or her arrival.
I really take it personal. I take pride in my job, for one, and another thing, I want to make sure that the patients are safe, and and that I'm safe, and the rest of our staff is safe. So I do try to do my best at my cleaning.
Mary, you mentioned changing the culture. To me, that means changing behaviors. What challenges have you run into trying to do that?
Basically, one of the main challenges that we face is that people maybe don't have a sense of the importance of it always. And we get in a rush day to day with what we're doing, and we kind of forget what kind of a simple priority it should be. And so it's really reminding people, and we do that through our education, through all orientation. I make rounds, that sort of thing, just to sort of remind people and increase their awareness.
Wearing a PPE, or personal protection equipment, is one of the many procedures in place to control infection. But when a patient comes into the hospital carrying a disease, it needs to be identified and isolated.
The first thing that we do is if there is any history of a patient having an infection, it triggers and in our medical record, and it will alert the staff that this person needs to go on a certain form of isolation precautions, meaning that it would protect them and protect the other patients in the hospital from getting an infection. So we have multiple forms of isolation precautions. When a patient comes in with certain types of infections, we have certain methods of cleaning and keeping the environment clean that are put in place in response to them having a specific type of organism like MRSA or C. diff. We clean our environment following a certain procedure or protocol that will alleviate the spread of that infection.
One thing that really intrigued me is the way you put the patient in. He empowered the patient to help take care of himself and empowered his family to help take care of him as well as other people. Tell us what that means.
Basically what it is that patients are the center of our care. They're the entire purpose for why we're here, and that basically is saying that in all of our procedures and all the policies that you and I have discussed, that's our number one concern and our number one priority is putting that patient in the center of our care and making sure that they're the first priority, and they are a part of that plan.
Hi, my husband says he's not feeling well, like there's fluttering in his chest.
At Washington Hospital, patients and their families are encouraged to voice their concerns and to ask about anything they don't understand, including questions about medications, the plan of care, safety, and their rights and responsibilities.
And here's our Please Ask brochure. We always want you and your husband involved in all of the care that's provided here. Don't be afraid to ask if you have any questions.
To help encourage such inquiries, the hospital has implemented the Please Ask program, including a brochure that spells out the ways a patient or his family can get the answers they need. Studies have shown that outcomes improve when patients and their families are informed and directly involved in their own care.
In the brochure, we talk about such things as asking about medications. If someone gives you a medication and it doesn't look familiar to you, ask, what is this? Why am I getting this?
Chris Lavoie is Washington Hospital's Chief of Compliance and Patient Safety Officer.
The other thing about the concept of Please Ask is that it should work for patients and patients' families across the continuum of care, not just when a patient is in the hospital, but when a patient is in a doctor's office, when a patient goes to the pharmacy to get a prescription filled. We believe that the more patients and families understand about what's happening to them, the better that the care will be, and probably the better the outcome will be.
Closely aligned with the Please Ask program is Washington Hospital's Rapid Response Team. The team consists of a respiratory therapist and an intensive care unit nurse, who are charged with assisting and evaluating patients if their conditions change abruptly. Patients and their families are encouraged to dial 0 to request the Rapid Response Team at the first sign that a patient's condition is worsening.
Are you okay?
I'm feeling anxious right now.
Okay, let me go call someone.
Who knows the patient better than their spouse or their child? They know what you're like and how things are going. And these subtle little changes are sometimes the key to getting there earlier and starting up earlier. And plus it makes the family member, puts them at ease to know that they've got something they can do.
Okay, so we call the team. I'm sitting there in bed with my nurse nurse waiting for the rapid response team to show up. Who's in the posse?
Okay, well the team is me, I'm the rapid response nurse. Then we have a respiratory therapist, usually the lead respiratory therapist. They bring a lot of respiratory skills, and probably 50% of our cases are patients who have breathing problems. And not to be left out at all is the bedside nurse, who's the one that really has all the information about that patient, because what we try to do is get nurses to call early. We want them to call early before things really go bad. And that's the key to this whole thing, is to get there early, and probably more than 50% of these patients don't have to be transferred down to the ICU. Let's feel your pulse and see what's going on here and see how that feels. We're not saying we can handle everything, but we get up there and we know what we can handle and what we can't. And if we work with a patient, say they've got a breathing problem, we give them a breathing treatment, we give them a little extra oxygen, and listen to their lungs, and they clear up and they start to get better, we're fine. If we get up there and we see that their oxygen saturations are really low, they're doing poorly, we can pick that up pretty quickly, and I'm right on the phone to the ICU saying, I need a bed. And then we as a team, we transfer them down. I think we've made safety a priority. It's the foundation for everything we've got to do, and it's an important thing for me and my team.
Coming up on Inside Washington Hospital, operating room procedures and medication safety for the patient in the hospital and at home.
We have a better way to treat brain tumors without surgery or anesthesia. There are no knives, no cutting, no nausea or hair loss, and no hospital stay is required. Presenting outpatient gamma knife treatment at the Taylor McAdam Bell Neuroscience Institute in Fremont. Go to gammaknifeprogram.com to learn more. Every woman is unique. At the Washington Women's Center, we take a unique approach to your health. We offer a comfortable, supportive environment, state-of-the-art technology, health screenings and resources, and we're the first center in the Bay Area to be named a nationally accredited breast center. We're more than a health provider. We're your health partner. Call to schedule an appointment.
Couldn't help overhearing about your migraines. Not surprised, there's a lot of interferons floating around this place. I got one word for you. Tin foil. If that doesn't work, you can always borrow my DMAG unit.
Presenting the InHealth channel, a much better source of information on issues affecting your health and safety. Brought to you by Washington Hospital.
You gonna finish that donut?
Washington Hospital's commitment to patient safety can be seen no more vividly than in the way we do things in the operating room. It is here that the hospital employs strict protocols to ensure safety and accuracy. On the day of the surgery, the nursing staff identifies the patient, checks the chart, and makes sure both the patient and family are clear on exactly what procedure will be performed.
And it says here that you're having a carpal tunnel. That's what that repair is called. Is that what your doctor told you? Yes. Okay, and this is your signature down here?
A similar process will take place 2 more times before the surgery. First by the anesthesiologist and then by the surgeon who will perform the operation.
Ready to count?
In the operating room before surgery, the team keeps track of the materials that will be used in the procedure by performing a sponge count. It is essential that the nurses hand count the sponges, sharps, and needles to prevent inadvertent disposal or the loss of an instrument in the surgical area. The count is documented on paper and on the dry erase board before beginning the case. When the surgery is completed and before closure, another count is made to assure all sponges and instruments are accounted for.
Everything we counted, right? Okay.
Everybody has their primary roles that they have to do, and each person knows their roles, but at the whole time, the whole team is communicating. That's part of the timeout process.
What's a timeout?
Timeout is when after everything is prepared, right before we actually start working on the patient, the nurse will call a timeout. Everybody will stop what they're doing, turn around and pay attention. The nurse or the surgeon will go through the patient name, the procedure that's on the consent that the patient has signed, and we'll go through that, and everybody will confirm that that is what that's what they're expecting to perform on the patient, and everybody is in agreement. If there's any disagreement, then that's resolved before the procedure's ever started.
Washington Hospital has implemented a new high-tech sponge count system utilizing radio frequency ID technology.
Well, these are gauze sponges used for multiple things within surgery, but they do go into the patient's wound, and our important thing is to make sure we get them all out. And this sponge is called a Raytech, and it has a small chip in it. It's a radio frequency ID chip, and this is the latest technology that's available. We will be the first hospital on the West Coast to implement this, and with this we have a machine that will do our manual count and still follow all the safety rules there, but we'll also use this device to help us count these machines. So the machine will know each sponge went in and tell us exactly what is missing, if anything is missing.
Tracy, thanks. Thanks for taking us inside Washington Hospital's operating room and the safety procedures we're using here. When the patient is ready to leave the hospital, he is often prescribed a number of medications to aid in his rehabilitation and recovery. And that means the priority shifts from hospital safety procedures to ensuring the patient's safety at home. That is the key focus of medication reconciliation, which requires that a list of all the patient's medications be compiled to ensure that he's given the correct medications and the correct dosages at every stage, from admission to transfers between units in the hospital and again at discharge.
Hello, Mr. Marquez. So your doctor says that you'll be going home, and he finished all this paperwork for you. We have all your discharge summaries for you.
Patients are often not reliable historians of what medications they're taking, and many times they go to see multiple physicians, and there is currently no universal electronic record that would tell us what medications a patient is currently taking when they present at the hospital.
On an average, a 65-year-old patient has 4 to 6 medications, and a 70-year-old has 10 medications. So you can imagine when multiple physicians are prescribing these medications.
Recognizing the need, Washington Hospital developed its own in-house computer program we call MedRecon Plus. Acknowledged nationally by the healthcare community, it is user-friendly for all and provides a tool for identifying an accurate list of all medications a patient is taking. It maintains and generates a list of all medications to be taken at home, prescriptions, discharge instructions, and a discharge medication list. Does it really work well? And it's especially nice because it was designed here. We can work with the people who invented it as we make our rounds. Can you comment on that?
We recognize this crucial need for information, particularly when the patient comes into the hospital. So a concerted effort is now being made by the nursing staff when the patient comes into the hospital to compile this list of home medications. However, what we have done is now we've added a pharmacy technician into the mix to assist the nurse.
Medication reconciliation is often misunderstood. Medication reconciliation is not just compiling a list of medications. It involves 3 processes. First is to obtain the list of medications that the patient is on. Second is to verify the exact dosages and to cross-check. And then finally, to use that to order medications.
The reason why this is an important safety concern is because there is a lack of reliable information for the prescriber, particularly at these transitions of care, as we mentioned, at admission, at transfer, and at discharge.
For example, if the patient is transferred from the emergency room to the surgical floor, the list of medications is checked again before any new medications are ordered. In a similar fashion, when the patient is being discharged, the list of medications that the patient was on at home are cross-checked with the medications that the patient was placed on in the hospital.
At the time of discharge from the hospital, the patient and his family are given the document with clear, concise instructions. It is written in plain language with non-medical jargon for all to understand.
As for your list of medications that you will be continuing at home, here is the list. It's rather long. So we're going to continue all the medications right here. The ones in bold are your new medications.
The patient is instructed to take that list with them to all their healthcare providers and to give it to their family so that at any time, if they had to present back in the hospital, we have an updated list to start with.
This tool will allow the nurse to go over each and every process or instruction that the patient needs at the time of discharge. Either the patient or the patient's caregiver acknowledges that they've gotten the instructions. This is as comprehensive as it gets.
As you have seen, ensuring patient safety is a very large part of Washington Hospital's overall commitment to quality care and to the patient-first ethic. The hospital's goal is to make certain that every effort is made to ensure that each patient receives the finest care in the safest possible environment every step of the way, from the moment he or she arrives at the hospital to the time when he or she no longer requires prescribed medication and after returning home. And that will mean better outcomes for our patients and for our community. I'm John Thomas Mehigan. Thanks for watching Inside Washington Hospital.